Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the MedSurg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the MedSurg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Hematologic system performs 3 crucial functions: oxygen transport, hemostasis, and host defense.
We are in chapter 33, Assessment of Hematological Function, and why this chapter is so important. It talks about whole chapter about the labs and related a little bit condition about the red blood cells, the white blood cells, platelets, and what each means. Kind of give us an overview how we can teach a patient or for us to understand better the labs. And I select this picture from the outline and I put it in here. I feel like it's super nice since it has all the labs and picture, color, all beautiful. So I would like to go ahead and like in each section, each video about each chapter, I'm gonna come and talk about NCLEX, how it's going to be tested, and make a compare and contrast with the chapter we studying about hematological function. And you see here we have these 15 domains. I counted, there are 15. This exam is until next year, until March 2026. Then it's changing to a new version, probably high tech. Maybe you can make it at home, you know, this type of exam that it's proctor or more domains. I didn't really look into it, but because now this year we focus on what we have now. Next year we focus on next year. Now we focus on this year. So as you see, the basic care and comfort, we got below. The other one is near. So here is the definition of each of them, and I think most of you guys who know about it. If you had the NCLEX already, and if not, then this is the definition. If you really want it, print it out as a PDF. I have it in the description, so you can just look down below and save it. It's from Google Drive, so you just take it and you don't have to do anything. Just download it on your Google Drive. And those 15 domains, we can learn how it plays them into the correct context for the exam. So making connection to clinical judgment, recognizing cues, analyzing cues, prioritizing hypothesis, generating solution. So what how is going to relate to our chapter? So recognizing cues is like what clinical manifestations are observed in this patient, like with the blood disorders. If you have a case study, analyzing cues like how do the clinical manifestation correlate to the underlying pathophysiology, uh, prioritizing hypothesis, what could happen if the patient symptoms are not effectively managed. Generating solution is what treatments are included to manage this patient condition. Taking action, what are the priority intervention for this patient? Evaluating outcomes. Anyway, even if of the NCLEX, you work in a hospital and you have 4 or 5 patients, or home health, you go to a patient, and now how you evaluate outcomes, you need to evaluate, and even for your own visit, like, or for your own shift, how the patient was at the beginning and what did you do to the patient throughout your shift or your visit, and how it responded to treatment, and if the patient tolerated well, um, if the patient accepted or was confused, or all kind of things. So it's not just NCLEX, it's just different situation, how it's going to apply when you evaluate outcomes. So what findings demonstrate that the treatment plan is effective? So you find something about a patient, um, now because we're in with a blood condition, so now I had the uh, clotting disorder or bleeding. You give medication, and maybe you need, before you give medication, you need to make sure you evaluate, make sure it doesn't bleed, or if had a fall and now it's bleeding, and now you give anticoagulants, so what findings demonstrate that the patient treatment plan is effective? What follow-up data are needed? So kind of those things. And here it say like you need to complete this pie, and I'm always guided. Here, this is from, you see, arena tool, medical, surgical, nursing. It's from ATI. And from the blood, it says right here, when you're reviewing the following chapters, keep in mind the relevant topics that and tasks of the NCLEX outline in particular. You see, basic care and comfort, it's hydration. Evaluate the impact of disease, illness on nutrition. This is related about blood disorders. Then pharmacological and parental therapies, right? It's from this pie. Blood and blood products. Identify the client according to facility or agency policy prior to administration of red blood cells, blood products. Administer blood products and evaluate client response. Medication administration review pertinent data prior to medication administration. So here is the blood products in this chapter, doesn't talk much, but in RN skills lab, it's there some classes where you will learn how and all the data you need about the blood products, and you need 2 RNs. Reduction of risk potential, laboratory values. You see, labs. Identify labs values of ABC, boom, cholesterol, glucose, hematocrit, hemoglobin, glycolipase, hemoglobin, platelets, potassium, sodium, white blood cells, keratin, PT, PTT, and APTT, INR. Potential for alternation in body system. Identify client with increased risk for insufficient vascular perfusion, potential for complication of diagnosis, treatments, products, monitor the client for signs of bleeding. And then here for psychological adaptation, alternation in body system, applied knowledge of nursing procedures, pathophysiology, and psychomotor skills when caring for a client with an alternation in body system. Hemodynamics manage of care of a client with alternation in hemodynamics, tissue perfusion, and or hemostasis. An unexpected response to therapies, recognize signs and symptoms so client complication and intervene. So this is the page in the beginning of the chapter. There are 3 chapters about blood or in ATI. One is exactly about blood transfusion and all blood products. One is a little bit about assessment, and the other one usually focus on bleeding disorders, anemia, little bit, and leukemia. So, but Davis has a lot of diseases, which is in next chapter, but ATI focus on just like half of it. This page screen, short screen, is from Medical Surgical in the edition from 2000. I think 19 or 2020. So it's a little bit older, but it's not much difference between 5 years ago and today. Blood, about blood and red blood cells and white blood cells is the same. Didn't change. The questions and a little bit here and there is might be changed, but I mean 5 years ago we had red blood cells. Today we still have red blood cells. We don't have blue red cells. So anyway, it's an older edition, but um, I'm reviewing in this. So when I review for the NCLEX, I do, as you know, Kaplan, ATI I know since LVN school, and that's why I'm using a lot those type of books, because I got it at the time and I felt like I'm gonna go in the RN program right away, so I bought the ATIs, and then the COVID started and I work overtime, so no time for school at a time, so I put school on hold, but I had ATI since then. So, okay, let's move forward. Too much talking of me. Agenda for today, it's chapter 33, assessment of hematological function. So we have a quick review of the chapter in case you didn't look over, or because you are not interested, because it's just RN NCLEX, so you don't have to re-listen to the whole outline, because that is just for the students. And this case study, I have a case study with 6 questions and 4 related to the chapter. I don't have 15 questions. Usually I have 15 questions, but this chapter doesn't really need 100 questions to know. It's mostly like labs you need to know related to this chapter. So we go next. Here, this is a short screen from my outline of the chapter. I like tables. So this, I made it last about 6-8 months ago, early in 2025 I made this. So now we're in October. So I made it sometimes in March. This, and now it's October. So at that time I liked this format. I thought it's cool to have kind of double lines. At that time I thought like it's so pretty, so cool. Now so anyway, so here is the diagnosis, test and assessments. And you see the CBC with differential check levels for red blood cells, white blood cells, and platelets. And bone marrow biopsy confirms blood cell disorders in outline. It's also, I talk a little bit, very like one sentence about what a nurse should do for the bone marrow biopsy, like sideline, put pressure, for after the biopsy is made, and it's on iliac crest. Then the physical exam, you look for pallor, fatigue, jaundice, and petechiae. And then patient interview, ask about the diet, bleeding, family history, and fatigue. Anemia, focus area, pathophysiology. It's all about oxygen delivery due to decrease hematocrit and decrease normal hemoglobin. Here on the types of anemia, it's all about nutritional, hematolytic, bone marrow failure, bone loss. So nutritional, we know it's iron deficiency, folic acid, vitamin B12. That's why even the pregnancy, this is very important. And children with iron, I think most of the children, they are anemic. Because they cannot assimilate and the body doesn't make right away. So it's recommended to give a lot of vitamin C to children, just to make sure they the food they take and vitamin C, they blood can have iron. I think every child that and mother, actually mothers that they tell me, I see their children a little bit pale and everything, and they have these behavior issues, a little bit cranky, how we speak, um, because they lose a lot of iron. The adolescent girls, when they start same with their periods, they lose blood and then they have iron deficiency. So vitamin C, orange juice is very important intake for to teach a patient. Hemolytic, it's this Mediterranean, it's a Mediterranean anemia, this thalassemia. This also it's rare, so it's a little bit rare. Bone marrow failure, aplastic anemia. I think most of you guys know about this, but this is in next chapter. Blood loss, acute trauma, or chronic bleeding. So we're going next now. And here, same, it's from same outline that I made, I said a couple of months ago in March. And you see, now it's one line. There was two lines. It's just to kind of differentiate. This I made for myself, like I like tables. When I study, for me it's tables, and usually has to be less pages. I don't want an outline to be more or notes more than 5 pages. I think it's a roman, a novel. Two, okay, but I think around 3, max 4, if it's a heavy chapter. But if it's getting more than that, that means it's too much info. And here I use this in case you have a quiz. And it's about true or false, or you need to have a drop, you know. And this I talked in key terms about them, because it's type of key terms. You see a protein produced by kidney that stimulates red blood cells production in response of low oxygen levels. So I'm sharing with you these. Oh, and this also, the lab value change. This is very popular. And you know, some teachers likes in their quizzes to have mix and match, so you have to kind of look what means this. And this is most popular, I found out, like decreased hemoglobin, you see, associate with anemia. Then the reticulocyte count in sickle cell crisis. This is very important disease, I think, the sickle cell crisis. Yeah, I considering very, very important. Same like anemia. Well, it's anemia, but the way the cells, red cells are, it's a little bit, how to say, in my mind says strange. They are strange. But when a person is in a crisis, you need to identify the signs and symptoms, and it's just black and white. If you know them, it's black and white. So if you know them, 3, 4, then when you see a patient, say like, oh my God, do you have that? And you know what to do, because when they're in crisis, they cannot tell you what's wrong, because they're unable to talk, to speak. And if you give them the medication, they get better. So one of the patient teaching, you need to tell them to have the medication in the car, to wear the bracelet, to have make sure when they travel. So it's kind of to have double supply of the medication in case they get in this crisis. If they have low platelets, it's risk of bleeding, then increased white blood cells is infection. This is the iron, ferritin, it's iron. Increase in INR, it may reflect warfarin overdose. Then this is associated with iron deficiency. Bilirubin suggests hemolytic anemia. And here, this is very, I like this table, so I'm sharing with you. Okay, so now we go to the next slide. And now this is also a short screen from the ATI. It's from a chapter 39 from the RN book, and here I take my highlight out, and if you want you can take a short screen, and if you see all the values and what means, I make a quick and then I will remove, promise. You see here elevated, decrease, elevated, decrease. So it's very important to kind of remember this. So now I delete. So we go next, and here I have the subcategories we were talking. So it's likely testable topic from this chapter, what they ask, and the pitfalls to avoid. And here are NCLEX subcategories, domains, and you see here basic care and comfort, which it's very everybody, not everybody. I think 90% of people that fail this NCLEX, it's because of this subcategory. I seen that. So what it says, energy conservation for severe anemia, plan rest periods, cluster nursing care, pushing ambulation before transfusion, syncope. Safety and infection. NCLEX loves these questions. Neutropenic precaution, central line care for chemo. Select the best protective isolation steps. Choose a sterile technique for line dressing. Forgetting to place a mask on the patient when leaving the room. You see, forgetting to place a mask on the patient when leaving the room. Management of care, transfusion consent. You need consent for everything for patient. You need to ask consent. And verification, delegation during bone marrow biopsy. Prioritize RN oversight for blood products. Pick a task that must stay with an RN. Signing consent, checking identifiers, letting the UAP, which is the CNA, monitor the first 15 minutes. No, because you need to avoid that. You need as an RN to do this. And it's 2 RNs for transfusion. Let's see, ignoring critical dropped in platelet count. Oh yes, here every time, like especially in hospitals, patients they are in blood thinners. And when you look for it, like everybody, and then everybody needs to look. So basically you need to look how it was before coming and during that day, and you need to know the policy in case it's low or it's too high, because sometimes even if it's a little bit low or a little bit high, the policy says like you can give or not to give. It is between this, so make sure on that. Yes, health promotion and maintenance, diet, teaching, iron, B12, folate, vaccination before splenectomy. Identify foods in iron, folate, schedule pneumococcal vaccine, uh, advising the patient to take iron with milk. You need to avoid that. Decrease absorption. So you need vitamin C. And the iron injections, it's stains, and iron itself stains. Okay, we go in the next part of these subdomains. We have psychosocial integrity, coping with chronic disease. We see body image after splenectomy scar. Provide support groups, therapeutic communication, uh, dismissing fatigue complaints as depression only. So this area is to avoid. Here, calling the provider without baseline data. Blaming the individual nurse. uh, oh yes, the cultural and spiritual concept also, it's very important because they refuse transfusion. Here, evidence practice use computerized blood barcode scanning. I think everybody knows this. I think the tricky question might be like here to when they transport and they don't have ID check and something gets wrong with uh, the ID of a patient. No, this is mostly like quiz taking, not NCLEX. But teach with B12, yes, but very rarely in NCLEX. But this is mostly like in quiz taking. I made a little bit more, but I doubled the. So these are the same like earlier, but I put more data in the table. Here, pharmacological and parental therapies, heparin versus warfarin labs, APTT versus INR, factor 10A, XA inhibitors, iron preparation. So to calculate the drip rate, identify therapeutic ranges, INR 2 to 3, know the antidotes, protamine, vitamin K, drawing a APTT at the wrong time, giving IM iron without Z-track, staining irritation. Yeah, because it stains the iron injection I said earlier. Yeah, it's a little bit, and here you see letting even the LVN and the CNA star blood. Yeah, because it needs to be for blood products, it's 2 RNs. Star blood or complete the second check. Starting transfusion before baseline. Here, start even is with an RN, you need to have a baseline. You need to have baseline for everything, not just, oh, here, 2 RN verification. Staying with the patient for the first 15 minutes cannot be delegated. Ensure consent is on the chart. Yes, so let's go more. And here we are in NCLEX for case studies question. I made it up this patient, 62-year-old man. Chief of complaint is progressive fatigue, dyspnea on exertion over 3 weeks. History is hypertension, daily NSAIDs used for osteoarthritis, occasional colored stools. Vital signs, so this might means that it's a little bit blood. Vital signs, so temperature 98.4, okay, heart rate 108, a bit high. Blood pressure is a little bit low because it's supposed to be like 102. I have 100 and even 98 and 102. That's my baseline forever and always and forever. So this we don't know for sure, but 58 is kind of low, so a little bit dehydration here. The respiration rate 22, okay. Oxygen saturation 94, so it's decreased a little bit. Usually it's supposed to be a little bit high, so it's a little bit here. Let's see, laboratory data. Hemoglobin 7.4, low. Hematocrit 23%, low. We have microcytic reticulocytes, it's decreased. Iron decreased. Ferritin, it's low. Platelets, it's increased. White blood cells, neutral. And then the PT, it's 13, INR1, and PPT is 33. So the diagnostics tool, Guaiacic positive, melena, orders, type, and cross-match to units of the products of and then IV normal saline at 100 ml per hour, schedule KD hold NSAIDs because of the bleeding. We give 2 liters of oxygen, nasal cannula, PRN if it's lower than 92%. CBC every 6 hours, virals every 4 hours. So, okay, select all of the apply. Which findings support the nurse suspicion for iron deficiency anemia in our patient? MCV 72 platelets, ferritin, reticulocytes, or IRNR. So it's select or apply. So it's A, C, and D. A, the MCV, the ferritin, and reticulocytes. So the low MCV indicates microcytosis, ferritin lower than 15 confirms depleted iron stores. Low reticulocytes count shows inadequate bone marrow response. Thrombocytosis, the platelets can occur secondarily but is non-specific. Normal INR is unrelated. So this in NCLEX, it's about from reduction of risk potential, psychological adaptation. Go to the next question. Order the following nursing action from highest to lowest priority after the lab results, drag and drop. So you have a table and then you have to kind of move which one is first, which one is second, and which one is third, and so forth. So from the highest to the lowest. You apply oxygen. You start the normal saline. You notify and then obtain consent for blood transfusion. So support oxygenation first, then restore volume, notify the provider for transfusion, right? Then secure consent. So this is management of care, clinical judgment. Like in those 15 domains, you get like some questions that they have 2, even 3 domains in one question. So this might be the same. Which diagnostic study will best identify the source of our patient bleeding? Colonoscopy, esophagogastroduodenoscopy. Oh my god, longer than this could not be. Capsule endoscopy and abdominal ultrasound. So we have bleeding. Think about this bleeding. So esophagogastroduodenoscopy. Because Melena and NSAIDs use suggest the upper GI source and the EGD visualize the esophagus, stomach, and duodenum because it's esophagus, gastro, the stomach, duodenum, and scopy, it's the and the NCLEX domain is reduction of risk potential. So you see, like if you think about how those domains are and how the question can be, it's kind of good to know, okay, the diagnostic and how I identify, it's the reduction risk potential, because we talk about the bleeding and identify the source of the bleeding. So you have its reduction of risk potential. The provider prescribe ferrous sulfate, so it's the iron, 3 times a day. Which teaching point is essential? Take with meal to increase absorption. We said earlier in domains what to avoid. Expect stool to turn dark or black. Chew tablets thoroughly before swallowing. Stop the drug once the hemoglobin reaches 10 grams per deciliter. So expect stools to turn dark or black because that iron does. Iron darkness the stool. Milk impairs absorption. Tablet should be swallowed whole or in enteric form. Therapy continues for months after hemoglobin normalized. So this is the pharmacological and parenteral therapies. Of course, every time when you see medication, you know it's pharmacological. After transfusion of 1 unit of blood, the patient develops chills, so it's no bueno. Fever 105, oh, 5. 105, oh God, 101 Fahrenheit, and back pain. Why did I say that? What is the nurse's priority action? Slow the transfusion rate, stop transfusion and keep IV line open with normal saline. Notify lab to retrieve the blood bag. Administer acetylcholine per PRN order. Stop the transfusion and keep the IV line open for normal saline. Those signs indicate a possible acute hemolytic reaction. Immediately stop the transfusion while maintaining IV access. Yes, because in case of something, you need to give IV meds or more normal saline to that IV port. So safety and infection control. Safety because you provide safety for the patient. You need to stop transfusion. And infection control, it's one category, but here they talk about safety because this is the priority action. You stop, I give safe, make sure the patient is safe. Which finding best identify that treatment for anemia is effective. Reticulocytes count. B. Hemoglobin increases by 0.5 grams per deciliter after 1 unit. Resting heart rate 118 beats per minute. The patient report dizziness when standing. So it's effective. Which findings best identify? So this is like evaluate. Let's see. So hemoglobin increases, so that it's the best that indicates that the treatment was effective, because that you want to do for the anemia, make sure. And each unit should raise hemoglobin by about 1 gram per deciliter. So 0.5 increase reflects partial improvement. Other choices show persistent anemia. So psychological adaptation. And also here it's how you evaluate the outcomes from the NCLEX domain. I think I forgot to write. Select all of the apply, which is Mr. Carter's home medication supplements increases his bleeding risk. So you have to do patient teaching. And they talk about medication and supplements. Ibuprofen, lisinopril, fish oil supplement, omeprazole, ginkgo biloba. Ibuprofen, we know this. I talked this before. In other, I think in other videos I talked about ibuprofen that you need to be considerate about ibuprofen to patients. But me personally, ibuprofen is better for my body than acetylcholine. Let's see, lisinopril, not. Fish oil, yes. Ginkgo biloba, yes. So why end states? Fish oil, ginkgo, all inhibits platelet aggregation. So we know that when we talk about medication, supplements, it's pharmacological. Yeah. Two more questions. Hematocrit is best defined as average size of circulating erythrocytes, percentage of blood volume occurred by red blood cells, amount of iron bound to transferrin, proportion of immature red blood cells in circulation, percentage of blood volume occurred by red blood cells. So this is the basic care and comfort. Hematocrit reflects the packed cell volume of red blood cells. Kind of, you see, it's best defined. I think this can be also in patient teaching. When a patient asks nurse, what that means, you know. Which pre-procedure platelet count require notification of the provider? A. 145, 220, 80, 350. 80. Why? Because below indicates thrombocytopenia. So I thought before means penia means low. That is the suffix. Increasing bleeding risk. So the domain is safety and infection control. Mostly it's in safety because it's in the same domain, but this domain has two guys here. Safety because you want to make sure that the patient is safe, and that's why you have to notify the provider. A left shift on CBC differential indicates. I talk in the key terms about this. It's a key term. So it's increased the lymphocytes, suggesting viral infection. Evaluate band neutrophils indicate an acute bacterial infection. Decrease eosinophils related to allergic response. Elevated basophils are consistent with a parasitic infection. So it's elevated band neutrophils indicate an acute bacterial infection. And here it's the correct answer. It's a search of innate neutrophils band. Typically signals an acute bacterial process. So the domain is a psychological adaptation. So that's it we have for this chapter questions. No more question. Yoo-hoo! So thank you guys, and I will see you in the next one. And drop down a comment, please. What do you think about those questions?